Welcome back, everybody. I would like to call us back to order for session 2 of our meeting on COVID-19 and the Savannah River site. The goals for this discussion are the same as the goals for session 1, but we now want to hear from the National Nuclear Security Administration. To briefly recap, we talked through how the department has approached operations during the COVID-19 pandemic and what we can learn for the next time if a similar situation has arisen. So I'm going to turn to my board members for brief opening remarks, and I will start with Mr. Summers.
Thank you, Ms. Connery. I would just like to take this opportunity to thank those participating today and sharing your views so that we can increase our understanding and improve the dialogue between DOE and the board. Thank you very much. Back to you, Ms. Connery. Thank you.
Thank you, Mr. Summers. Ms. Roberson?
Thank you, Ms. Connery. I'd like to just say hello to our participants and thank you for doing so, and I look forward to the dialogue. Thank you, Ms. Connery.
Thank you. And I'm going to give my personal remarks, and they're going to be a little bit repetitive from this morning just because I want to make sure that our colleagues from NNSA hear them as well. I wanted to start out the session by the same way I started this morning, that we're holding this meeting not because of any safety deficiencies that our staff noted with regard to how NNSA in general, or Savannah River in particular, operated during the height of the pandemic. Instead, we wanted to have a discussion with you about the trade-offs you may have made, how you made your choices and communicated them, whatever lessons learned that you had gleaned during this unprecedented situation. In our view, it's important to understand how to operate in a constrained environment, what innovations were made, which should be carried on, and which should be not carried on as we return to an unconstrained environment. As I've said in other venues, COVID has impacted us in ways that we still don't know. It has impacted the entire workforce of the nuclear enterprise as well. What we do know is that we were all profoundly impacted, and I want to acknowledge the men and women who work in the NNSA nuclear enterprises for persevering through a difficult and uncertain time and carrying out their mission in the midst of a pandemic while worrying about their families and loved ones. On behalf of us all, I want to thank you and your team for commitment to work and all that you do for the American people. So with that, I do want to introduce our panel for this afternoon, or this morning. This second session, we have Dr. Charles P. Verdon, who is the Acting Undersecretary for National Nuclear Security and the NNSA Administrator. We also have James Armstrong, the Manager of the Savannah River Field Office. Finally, in a supporting role, we have James McConnell, the Associate Administrator for Safety, Infrastructure, and Operations. Like the first panel, I believe that you all have a few words to say before we start, so I will turn it over to you, Dr. Verdon, for opening remarks.
Okay, thank you very much. So good morning, and thank you for the opportunity to speak with you this morning on behalf of NNSA and to address our operations during the COVID-19 pandemic. I'll just try to quickly summarize that from the start of the COVID-19 in the United States, NNSA's response was guided by protecting the health and safety of the workforce while working with our field offices and site leadership to continue to deliver on our highest priority national security missions. Just a quick, how NNSA worked with DoD to identify those missions that we couldn't let lapse. We worked closely with them to identify those, and clearly it wasn't everything that we do across NNSA, but it was a lot of key mission deliverables, particularly related to the stockpile. We provided those priorities in writing to all sites, along with a companion memo from the DoD that was authored by Ms. Lord, outlining similar direction to the DoD organizations, because there was considerable overlap in the number of the activities for obvious reasons. The site field offices and leadership were given the responsibility to determine how best to continue to deliver on these identified priorities while maximizing workforce health and safety. And I'll just say quickly, in general, all sites identified those essential workers needed to be on site to carry out the mission. They worked with site, local, and CDC health experts on how to perform the work as safely as possible, implemented their recommendations, slowly and carefully phased the on-site work back in, monitored the environment constantly, and adjusted as required. For the workforce not required to be on-site, telework was implemented to the maximum extent possible. Headquarters held weekly virtual meetings with all sites to track progress, share lessons learned, and adjust priorities as required. And, it was a teams of team effort. It was really across the board. As the pandemic proceeded, NNSA incorporated national guidance as it became available, follow-on guidance from the Office of Management and Budget, as well as direction from the Department of Energy. All of these were and are being used, continue to be used to ensure worker health and safety while continuing to meet mission requirements. I would submit the DoD guidance document for the record so that you will have it. NNSA also prepared a plan that's subordinate to the DOE plan to guide our execution of operations in these uniquely challenging conditions. I signed out the plan on May 3rd of this year and would also submit that for your record. Again, no surprise, the key tenets are emphasizing maximum telework, a discussion of which mission requirements required more than 25% on-site occupancy of facilities, required safety controls, including facial mask, social distancing, travel approval, and quarantine requirements, personal habits and requirements of the workforce, and evaluation of local conditions and adjusting as required. So the M&O leadership in partnership with the field office managers will continue to make the final determination on a number of the personnel allowed on site or required on site and allowed on site, and the work authorized at the laboratories, plants, and sites. Their decisions have been and will continue to use a cautious, iterative, and data-driven approach based on expert guidance and mission priorities provided by the programs and functional offices. And so appearing with me today is Jason Armstrong, the current field office manager of NNSA at Savannah River. And he had, the on-the-ground responsibilities. So I think given the overall guidance, I would ask him to give you further details that are specific to the Savannah River site. Because each site we recognized is slightly different, and that's why we took the approach we had, where we had the field offices and the site managers really take the local responsibility of implementing the priorities that we were provided to them. So with that, I would, with your permission, turn it over to Jason for his comments.
Absolutely.
Hi, good morning. Thank you for providing me the opportunity to share with you the great work our team is doing here at the Savannah River site. I believe our agencies share a common interest in the safe operation of our nation's defense nuclear facilities. That's why I welcome this opportunity to share with you how we are managing our resources and our teams during the pandemic. I'd like to first share with you the resiliency and innovation of our team at Savannah River Tritium Enterprise to meet our nation's security mission while still preserving the health and safety of our workforce during the pandemic. Early on, the Savannah River site established the Infectious Disease Response Team. This team established a war room that was meant to lead, manage, address, and be responsive to the dynamic changes associated with the pandemic. The Savannah River site also developed a COVID-19 management plan to ensure that clear and uniform guidance was communicated across the entire site. Our M&O partner, Savannah River Nuclear Solutions for Treated Facilities, also tailored the site COVID-19 management plan that enabled mission essential work activities to be conducted safely while keeping our workforce healthy. For example, control room entry was limited to essential personnel, work authorization was conducted remotely when possible, and guidance was issued on sanitation protocols in the control room. Facility walkdowns were also conducted to ensure compliance with the management plan. Our commitment to emergency preparedness never faltered during this period. Through innovative ideas such as a COVID observer during drills and utilizing available technology, the Savannah River Tritium Enterprise completed 100% of all drills that were scheduled. They also performed an unannounced drill, and it conducted the annual facility graded exercise. We ensured all our emergency response personnel were trained, qualified, while still adhering to strict COVID-19 safety measures. Our field office also remained resilient and engaged as well. Our facility representatives developed a rotating schedule and while adhering to strict COVID-19 protocols. And they remained, I'm proud to say, COVID-free. Our safety system oversight engineers, our nuclear safety specialists, our weapon quality engineers, our health physicists, our safety professionals were also engaged. They employed a hybrid work environment where they would review documentation at site, off-site, and then come on-site to perform independent verification reviews, their assessments, and field walkdowns, also shadowing and working with the facility representatives. As we develop a plan to a less constrained work environment, several changes await us. The one constant is my commitment to safety is my number one priority, and the safety and health of my workforce is also my priority. And to ensure that all our operations within our defense facilities are conducted safely. So I'd like to thank you again for this opportunity to share with you our resiliency and innovation during this pandemic, and our continued commitment to the health and safety of our workforce. This pandemic really identified how our teams can be resilient, strategic, and at the end of it all, they become very innovative. And they have open communications with me all times to share with me great ideas to prevent and maintain the workplace safety. So I look forward to further discussions with you all, and thank you again.
Thank you both for your opening remarks. It was a really helpful and enlightening, and for the documentation that you provided to the meeting for the public as part of the record of the meeting. So I'd like to turn the first line of questioning over to Board Member Roberson to start. Ms. Roberson?
Thank you, Ms. Connery, and thank both of you as well, too, for your opening comments. I guess I'd like to start with you, Mr. Armstrong. You touched on this in your comments, and I want to give you an opportunity to expand. At DOE sites where there are multiple programs occupying a site and multiple contractors, sometimes shared, sometimes not, we often see challenges in communication and coordination. And I know you talked about how the Savannah River Tritium Enterprise established a war room. I wanted to ask you to expand a little bit more on how your organization and Mr. Bundy's organization did work together to ensure consistent approaches and execution of pandemic controls across the site.
Thank you, Ms. Roberson. I would share with you that the Savannah River site, when I came here, I believe Mike Bundy's organization had developed the infectious disease response team. They had developed a war room. In that war room, they also invited my organization to be part of that. And so we would engage at least weekly basis, talking to the folks on the teams, and it was comprised of both federal staff and our M&O teams. And they would share with us challenges that they're having, what COVID rates they're getting, what numbers of illnesses, those are on quarantine, and some best practices and what they're learning and what they're hearing. And so it's really through that close collaboration that NNSA has with the EM site that we were able to remain in constant conversation.
Thank you, sir. So again, also, Mr. Armstrong, as we know, the pandemic introduced new worker hazards that could challenge the contractor's ability to maintain minimum staffing requirements, which are needed to ensure safe operations. Many of the pandemic hazards and controls, like mandating mask use and social distancing, were being identified at the federal level and evolved as knowledge and experience evolved with the pandemic. Normally, DOE incorporates requirements into its contracts and relies on the contractor safety management programs to identify and address new hazards, and DOE reviews and oversees the results of those. So I wanted to ask you, with SRS having multiple facilities under different contract management, can you discuss how NNSA, the NNSA field office, oversaw consistent implementation of these new pandemic controls across its activities?
Are you talking specifically at the Savannah River treating facilities?
Yes, sir.
Local level. So the contractor at this Savannah River treating facilities is Savannah River Nuclear Solutions. They are the main contractor there. My primary interface, they're responsible for the execution of tritium activities. So we talk routinely. We talk every day. We communicate first thing in the morning, every morning, their whole team, my whole team. We talk about what protocols they have implemented for working safely with COVID. We both from a federal perspective and also from our M&O perspective. And then my team will go out and evaluate and make sure that we're doing that, and they would also do the same.
Thank you, sir. So if you can discuss a little bit for us as far as how controls were executed and assured in control rooms, where you have oftentimes limited space, demand for face-to-face communication, interaction, and oftentimes a lot of foot traffic. How can you discuss how you ensured proper implementation of the pandemic controls to maintain minimum staffing requirements in the control rooms for the operations that were ongoing?
So yes, I can. Thank you. So the as you conveyed, a control room can be a very busy environment, and during this pandemic, we've learned the value of social distancing, the use of face masks, the use of hand sanitizer, and another protocol they do here too is whenever they sit in a chair or at a desk or at a table, they always wipe it down with the sanitary wipes to be sure that it's sanitized for the next person to sit down. The M&O went through and they evaluated what was essential to have in the control room, and they limited to those personnel only. It took advantage of technology, took advantage of some cases using the phone when necessary. We have technologies such as Teams, WebEx, that we have phones obviously, and then they also had a lot of reminders of what safe work practices are required during the pandemic time period.
Thank you, sir. I guess one last question at this point for you also. As more of your workforce is vaccinated, have you identified the need for any additional controls or requirements to give you the assurance that as you go through this transition, both the workers are safe and the work can be performed that you need performed?
Yeah, so safety is my number one priority of our workforce. As you're well aware, leadership is a privilege and also a huge responsibility. So as my team transitions to work, I feel that responsibility to ensure that we can create a safe work environment. And part of that includes being able to learn. So every opportunity that we have to hear from our employees for ideas, we take that and we go with it after we evaluate it. It's appropriate to do so. It's important to have the voice from the employees, especially them who are out there on the deck plate, telling us how to execute the work safely and still efficiently and safely. And so we are always looking, always listening for what is a good way to execute the work while maintaining, preventing any exposures to the pandemic.
So one last question. While the pandemic has been a challenge, as you cite, it's always been an opportunity to learn, innovate, and improve. Mm-hmm. Have there been any specific recommendations or requests from the workforce that may impact that you may consider executing going forward as the workforce returns to a more normal state that you would carry over?
So some things that I've heard is when we wear a mask and we're not around anybody, can we take it off because I don't want to trip and fall? And that's an overriding priority. I don't want anybody tripping and falling, especially when they're on their own, walking through a parking lot or walking from one facility to the next facility. Those are things that we share, and we get those ideas implemented. Ideas where I've recommended an additional hand sanitizer be located somewhere else. We do that. We look for opportunities to allow our workers to have all the safety tools and equipment that they need, even before the pandemic. And now after the pandemic or during the pandemic, we're learning where are those best places to have the hand sanitizer. Where can an employee get a mask if their mask breaks? Where can an employee talk to their supervisor or talk to a peer or talk to some other worker advocate so they can share what other ideas that they may have to execute their work in a safe manner. So, Ms. Roberson, we're constantly engaging and developing, and a big part of this too is everybody's asking, what does the future look like? And it's very important to me that we convey that their health, their safety is our priority, is our nation's priority, and that we have to meet them where they're at and help them have the right tools so they can do the work. They're so passionate about our mission. When you come to our facilities, you'll hear that and you'll see it, and they want to figure out how to do it in this COVID pandemic. This is one of the few facilities that went right to work, and they learned so much along the way. I've only been here almost 3 months now, and I hear the charge from them, and I see the innovation every day, and how they have addressed issues and worked through challenges to resolve them. And it truly is remarkable.
Thank you, Mr. Armstrong. Back to you, Ms. Connery.
So I'd like to continue along the similar line of questioning, Mr. Armstrong, about the challenges of transition, right? So you talked about some of the opportunities of transition and listening to the workforce, and we're trying to predict what the challenges might be. So you've gone from, maximize telework, which I realized was limited for you all given the mission that you have, and then 25% in the workforce, and now return to work plans are due to OMB sometime mid-July, July 18th, I think it is. So I kind of want to understand from your point of view what the challenges that you foresee happening with the workforce returning to work, and should the department or the contractors enact a more flexible telework policy, how do you minimize the impact to DOE's effectiveness, particularly its oversight effectiveness and contractor safety management programs, in the event that there is a more lenient telework policy going forward?
So early on during the pandemic, the NNSA put all its leadership through emotional intelligence training, right? Being aware of our emotions, self-management. I think that began the groundwork for our huge challenge that awaits us as leaders in the organization on what was the best way to transition our workforce back to the office in a hybrid work environment. It's not as simple as turning on a switch and saying, "I want everybody back to office today." As you know, there are ongoing challenges with COVID-19. We hear of the Delta, we hear of other things happening. And so we remain aware and engaged. As we go forward, a big part of it is not only physical health, but also mental health. We want to understand, I think Mr. White mentioned it earlier about people at home have been caregivers to their children, to their grandparents, in some cases, even their pets, right? And leave their pet down and go back to the office is an emotional event for some people. And so we have to balance all that as we come back to work. We also have to balance our very important national security mission. And so we start looking at what does effective oversight look like, and what does it mean? And it means that we have an awareness of the work that's going on. We are a demanding customer. We hold them to be accountable for their work. And so we need to have our people out there in the field observing the work, but also observing our M&Os perform their own assessments. We need to evaluate those assessments. We need to participate with them in meetings to see what strategies they're developing for new work activities. So I start looking at this, which part of our organization is critical for that, and what does coming back to work look like for you? And then there's also, we need to we have had these listening sessions to understand what do the employees want, and what do they need to be successful in a hybrid work environment. I think we are learning there's power in coming back to work. I believe some high-tech companies call them collaboration days. They bring everybody back into the office for 2 or 3 days a week, because they recognize that while we became super innovative during Maximize Telework, we might even become more innovative if we develop a collaboration day. And so those are all things, Ms. Connery, that I look at, and I talk with Dr. Burden and his team as we return back to work.
I appreciate that. I really love the idea of getting folks trained on emotional intelligence and looking at the whole of your workforce all of the challenges that they face, because your workforce is part of your safety system. I think the other point that we brought up in the earlier session was kind of normalizing taking work off when you're sick, right? I think that is something that we here in Washington don't do very well, and I'm sure that it's a challenge on the site too, particularly with hourly wage workers, to be able to have the opportunity to take time off of work when they're sick, or when a family member is sick, to take that pressure off of them so that they can return to work. So I appreciate your answer on that. A question for you, Dr. Verdon. DOE identified lessons learned from the pandemic, and we asked the same questions to the panel earlier, and I just want to get your perspective on it. How were these lessons learned from the NNSA side of the house? How were they institutionalized, and how were they shared across the field offices and contractors so that everybody was able to benefit from them?
Yeah, so as I said, we took an approach of sharing lessons from the get-go. The very first meeting, we were sharing shared experiences back and forth across the complex, and we just continued to do that. So we've documented, as you recognize, we've documented the lessons, and we just openly share them, and we continue to do so. And not only, as I say, not only within our own organization, we also have worked to try to help our vendors when they've been willing to, take input from us, as well as interactions with DoD of what they've learned. So we've tried to make sure that we've been encompassing in all that area. But again, it goes back to the communications. We've just had open and free-flowing communications with this to make sure that we're getting the best that can be applied to each site, adjusting for their uniqueness of each site.
And just a follow-on, because you mentioned the Defense Department, were they willing partners in kind of helping to understand the priorities of the organization in the midst of the pandemic, and maybe being a little bit less of a demanding customer if the situation warranted?
Yeah, I mean, they were very good. If you take something like, I know it's not Savannah River, but you take something like our OST agents, we had many interactions with them to get an idea how they were continuing their training of their service members. How are they continuing, their necessary training during the pandemic? And we were sharing back information back and forth. So yeah, it was across the board, very open, very willing to learn both ways.
Excellent, that's great to hear. I'm going to turn it over to Mr. Summers for the next line of questioning. Mr. Summers.
Thank you, Chair Connery. And my first question actually is from the previous question or 2 questions ago that Ms. Connery asked Mr. Armstrong. Mr. Armstrong, I really applaud the many innovations that you identified in order to deal with the pandemic. Congrats. I know that early on, this question is concerning places of food and where people go to have lunch, etc., meeting rooms, small confined spaces, but primarily focusing on cafeterias and things like that. Early on in the pandemic, I believe it was identified that some of the areas at the sites and plants and laboratories were where people gathered to have lunch or snacks or breaks. And I was curious as to what steps, if any, you've taken or that you plan to take in order to limit the possible exposure or spreading of, whether it's the Delta variant or the Gulf Hotel, who knows, spreading of those various pandemic COVID-19 variants in the future. Thank you.
And Mr. Summers, thank you for the question. So upon my landing at the Savannah River site about 3 months ago, I had the pleasure of touring the facilities, the administrative support areas, also with both my deputy manager at Savannah River Field Office and also the vice president for SRNS for Tritium Enterprises. And during that walkthrough, we walked by the kitchen. And I probably pre-pandemic, I always loved the kitchen area, right? It's a great opportunity to see how folks are doing, hear about their son or daughter's new college ventures or getting a new car and that kind of drama. It's stuff you really miss. But now, when I walk through those areas, even though our M&O has a lot of people back in the office, they recognize that The kitchen is not an area to accumulate and sit there and talk to each other anymore. So you'll see signs in that area that encourage social distancing. You'll see the sanitary wipes all around. You'll see where you can use your hand sanitizer there. You don't see mask wearing as much anymore because more folks are now, those who had the vaccination do not require to have a mask if you're wearing. So that's in the M&O part there. I've been in that area probably over 100 times since I've been here. Okay, I'm a guy who likes to go walk around on the M&O side, see what's going on. So I've only seen like 2 people in there, and I see the K-cup coffee machines. I don't see them pouring fountains of coffee anymore. I see people bring their own K-cups in. Now over on the federal side, I don't have as many people back in the office right now, and our kitchen area is very sparse. I'm usually a lone customer, or when I bring my office manager in, she gets to come in there too. Our refrigerator pretty empty. It's a different environment, sir. And I miss the collaboration that could be achieved in the kitchen area, but I tell you, it's the area where you'll find a lot of sanitizer, wipes. You can find some extra masks in there in plastic. That's today's environment.
Thank you very much. I know that it'll continue to be a challenge, so I appreciate you explaining how you're dealing with it at your site. Thanks. Dr. Verdon and Mr. Armstrong, to change course a little bit and to pass along that earlier this morning, we discussed some of the challenges that we had, or that you had, in the enterprise in maintaining emergency response proficiency. And we discussed that with Mr. White and Mr. Budney, of course. We are aware that NNSA has taken a different approach than the Office of Environmental Management. Except for some pauses at the beginning of the pandemic and possibly during some of the holidays, the NNSA Savannah River Field Office and the Tritium facilities have largely continued performing their field drills throughout the pandemic. First question's for Dr. Verdon. Actually, it'll be a 2-part in just a moment, sir. Dr. Verdon, since NNSA has several work activities that support mission essential functions and primary mission essential functions, many NNSA work activities continued throughout the pandemic. Some NNSA field offices, such as Savannah River, Pantex, and Y12, have performed field drills and exercises throughout most of the pandemic, whereas some of the other NNSA field offices, such as Los Alamos and Lawrence Livermore, were strictly limited to virtual drills during the pandemic. So based on this, I have a 2-part question. First, sir, what is NNSA's overall strategy to manage the risk created by uncertain or declining responder proficiency due to the reduction in field drills and exercises? And second, in going forward, how do you intend to ensure that all of the NNSA sites are on a level playing field and are meeting emergency preparedness requirements? And I'm happy to repeat those, sir. That was a long introduction and a 2-part question. Over to you, Dr. Verdon, sir.
So again, I think what you're capturing is the fact that, again, we have allowed the sites to really have the field offices and the sites to have that determination of what was required. And as you indicated, some of the sites of which, clearly more of the high hazard activities take place, they felt it much more important to keep those drills not virtual and keep them real. So they made those decisions. We supported them, those decisions. They worked with their health providers, all the information possible to execute those as safely and securely as possible for their workforce. The sites that did do it more virtually, again, it was a local decision based on their risk posture that they could handle those virtually and keep the training up to snuff during that period. And then as they return to work, as they evolve their return to work, they are working on basically bringing those activities back on, potentially keeping some aspects of the virtual that they found positive, while going back to the more kind of hands-on in-person training that takes place. So again, it's not a one-size-fits-all. I think what we will require is the evaluation that they are meeting the requirements. How they implement the requirements will still be up to them, and we're giving them that flexibility, but we will have the oversight to ensure that they meet the requirements. If they can do it with a hybrid approach versus or need an all in-person approach, that will be up to them to determine.
Very good, Dr. Burden. Thank you, sir, for your answer. I would now like to turn over the line of questioning or questions to Ms. Connery. Chair Connery, over to you, ma'am.
Thank you, sir. So along these similar lines, and this is for you, Mr. Armstrong, can you talk about what changes or any new controls that were implemented at the Tritium facility so that they could safely perform in-person drills during the pandemic, since you were one of the sites that were able to operate during that time?
Yes, I can. And you're right. We did complete all of our required and necessary drills and exercises during this period. We were able to do so. As I mentioned, we really encourage ideas and innovation during this time period more than ever. We need to hear those voices. And one of the ideas that rose to the top was to have a COVID observer. And this person was a designated individual that was insured to make sure that all drill participants, even observers, regular observers in the drill, ensured and practiced safe COVID protocols. Some of our drills early on required the use of masks because that policy had not been lifted. But the social distancing, I've heard stories of that COVID observer coming in there and say, you need to get a little further apart. So it's like very active. And so this person that was their sole responsibility to go out and do that. And it proven to be very effective as we also do some contact tracing. And so we were able to identify that any COVID instances that we've had were not associated with emergency response. So that COVID observer is what we consider one of the best things we learned from there. We also took advantage, as Mr. Bundy spoke of earlier, that web EOC. And we were able to use our technical support room that could be activated during a drill and was able to participate remotely. That was the technical support room.
So when you used the innovation of the COVID observer to make sure that there was proper social distancing, that people were wearing masks, did that have any negative effect on the outcomes of the drill from your perspective? Did it add more artifice to the actual drill scenarios?
So when I asked the people about it, because I wasn't there during a couple of these drills where we first did that, and asked them how did that roll out and how did it feel. It's something that they're very proud of because it was the employee's idea. And so when we get ideas from our team, is how we can become better, and they actually start managing up and giving some great ideas. So the COVID observer was not considered an outsider in it. I think they actually welcomed it because it reinforced the need to maintain 6 feet apart. Or of course, hey, why don't you go ahead and wipe your hands? Or you just grab that pin. Somebody else is about to grab that pin now. So there's actually, nobody wants to get COVID. Nobody wants to get sick. And we hear those stories and they're heartbreaking. So I think for us to invest in a drill participant to be a COVID observer added a lot of value and showed the whole entire organization, both federal and contractor, that we care about their safety. And that was the message that was received.
Thank you. Ms. Roberson, over to you.
Thank you, Ms. Connery. Dr. Verdon and Mr. Armstrong, as we all know, early in the pandemic, DOE and contractor oversight personnel implemented a maximum telework posture, as we did. DOE established remote oversight capabilities for its program and field offices that enable DOE to protect its workforce while still providing oversight for its essential operations. So Dr. Verdon, could you discuss briefly how NNSA headquarters program office maintained their oversight effectiveness? Were there oversight enhancements or specific oversight tools that were used to ensure you had confidence, even in light of the fact that there was a reduced field presence capability?
I'd say that once we established what the priority of the work that had to be accomplished, again, it was turning it back over to the field to determine how best to maintain the oversight, at the field. And I think, and to a large extent, they basically they didn't miss a beat. They were able to do what they needed to do with both hands-on as well as teleworking from the oversight perspective of the field. And then, as I mentioned, we had weekly updates, especially during the early time when we'd bring all the sites together. We would review as a team what was working, what wasn't working, where we may have to slow down, where we could actually pick up speed. So it was just an open communications. But the oversight, again, we turned and relied heavily, as we do every day, on the sites, the field offices in particular, to provide the local oversight. And then from headquarters, we would, again, review from our level how things were going and taking their input, and also taking the temperature across the entire site, the entire complex. If one site was experiencing something and others weren't, we'd try to figure out what was going on and make sure that we understood that was it something that we need to be aware of across all sites, or was it just particular to that one site in particular. So again, reliance on the field offices didn't change in that regards.
Thank you, sir. So to you, Mr. Armstrong, the man of the hour, can you, I'm going to ask you the same question since Dr. Bergman said over to you. And also in your response to that question, I'd ask you to specifically address execution of field assessments and how they were impacted with the maximum telework policy and reduced field presence in place. And, if there were specific oversight enhancements or oversight tools that you use that maybe you hadn't used before, if you could discuss that briefly for us.
I'll be happy to, because probably one of the first questions I asked when I came over to the Savannah River team was to understand where we're at with our assessment schedule. We're tracking our M&O assessment schedule. And the answer was, yes, sir. And I was like, show me. Let's see what this looks like. And there's been an emphatic desire to get to yes since the beginning of the pandemic. Was everything from learning? You recall when the pandemic started, people had to work remotely. They thought it would be impossible. And yet we gained all these efficiencies, right? And that's the thing everybody's very proud of. And then we started going forward to what does the future look like? I'm sorry I'm going here for a minute, but trust me. So as we got forward, we started looking at how can we do assessments while we're in this pandemic? And the answer was, we can do a lot of the work at home, and then we can take opportunities to go out in the field for maybe 2, 3, 4 hours and reduce our time of exposure, right? Very similar to the LARA principle. As a health physicist, I'm passionate about LARA. So there's a great opportunity there where I saw that being implemented in real life. And so we completed all our field assessments. We conducted our operational awareness activities. We did our walkdowns. My nuclear quality engineers, my weapon quality engineers conducted their required phosphorus type level reviews. My safety system oversight engineers got out there in the field and look at their systems. Even my health physicists would track with the M&O's radiation protection department to see how things were going, still participate in the meeting. Then she'll come into the field, look at postings, look at how they're doing barricades, even look at how they're monitoring exposure. And then my industrial hygienists, the pandemic really illuminated their role in our whole life, right? Also, we were looking for them for our health too, and to watch them get engaged. And then they developed ways to even shadow and I don't want to say participate in. I know they shadowed assessments that were being conducted by our M&O. So there was an early on commitment by this team that we are going to conduct our assessments. We're still going to do our operational awareness activities, and we're still going to be cognizant of what's going on and out in the field.
Okay.
If I could add, sorry, if I could add one other comment, just for completeness. Some sites that did have absences in the field offices, what we would have is other field offices would actually provide support either remotely or, to fill in if somebody had to quarantine, say, and were staying home. Or then if if that was not available, then we would provide it centrally. So again, it was a sharing. It was a sharing across the entire complex to make sure that nothing was missed in that regards.
Thank you, sir. And thank you, Mr. Armstrong, for your response as well, too. To you, Mr. Summers.
Thank you, Ms. Roberson. Mr. Armstrong, the next two questions are for you, sir. And these are similar, in fact, almost the same, as questions we asked earlier of Mr. Budney. And so the first, and both of them, frankly, have to do with the facility representatives at the site. And the first has to deal with qualifying facility representatives, and the second has to do with the appropriate presence of those facility representatives at the site. So, Mr. Armstrong, sir, can you please discuss any challenges with qualifying facility representatives during the pandemic and how you have addressed those challenges? Thank you.
Yes, I sure can. Thank you, Mr. Summers, for the question. It's an area I'm really excited about because we actually qualified 2 facility representatives during the pandemic. It took a little longer than 18 months, I believe, but that's to be understood. It was less than 2 years, I know that. And we were so I have a whole cadre of 4 qualified facility representatives. The 2 qualified facility representatives got really engaged in helping us qualify 2 additional, those 2 individuals. So it was really a neat collaboration and teamwork, and then we had a lot of independence in review, and then I was the final signature on their qualification. As a previous facility representative, I take that very seriously, that signature and what that means. Because there are eyes and ears, the field office manager in the field. In some cases, somebody even say the mouth, right? So I take near and dear that. I'm very proud that we had 2 qualified. We have 4 facility representatives. It wasn't any twisting of arms saying, hey, I need somebody to go out there in the field. It was more than raising the hand, I volunteer, I volunteer, I volunteer. My assistant manager of operations had to say, how about just one of you? And then we'll have another one come in the next day. And then you stay home, and another one come in the next day. And then they arrange some type of virtual trade-off or turnover with each other. So the collaboration amongst the facility representatives was really good. Near and dear to the facility representatives, though, are my ES&H professionals. As we learned throughout the whole entire DOE complex through accident investigations and such, the importance of having our SMEs also in the field and engage with our facility representatives. So we also worked on how we can get our health physicists, our industrial hygienists, and our safety professionals out in the field too, along with the nuclear safety specialists and my safety system oversight engineers. And my weapon quality engineers also with that component too. So it's very dynamic. It wasn't twisting of arms. It was us saying, how does one of you come in, not all of you at one time? There's an underlying need. I think people want to be social and want to get back together right now. But right now we're cautious, but my team was able to work a hybrid work environment. And I really appreciate the team was able to do that during the COVID pandemic, especially early on. And the burden that the leader feels when allowing somebody to come into the office is real during this time period. So I'm very proud of this team that they were able to do it safely.
Thank you, Mr. Armstrong. In your description, I was thinking about one of the more challenging qualification activities, and that of being Radiation Worker 2 training, which requires a good bit of in-person demonstration of proficiency in being able to do those tasks or getting qualified in that task. Were there any changes that you were required to take in order to make sure that people qualified for those similar in-person kind of qualification tasks, similar to, say, Rad Worker 2 or Radiation Worker 2? Thank you.
Thank you, Mr. Summers. I began my career in the DOE as a health physicist. I was also a rad safety tech in the nuclear industry prior to going back to DOE, prior to going to DOE. So grad worker training is near and dear to my heart, and I think all life flows from rapid detection in the nuclear industry. So anyhow, I take grad worker training pretty seriously, and I like that a lot. There was one case here since I've been here where I did extend a, so when the M&O extends somebody grad worker training in my facilities, they have to get my approval. And I recently extended one, but it was after a conversation. It was the first one I had and the only one I had. And so I didn't quite know the protocols, and I just wanted to do a little bit more. So I brought the individual over, and I wanted to hear what they knew about rapid protection. And so I went and authorized that. My understanding, and I can get back to the record, is our folks were able to maintain their qualifications in rapid worker 2.
Very good, thank you. And we'll have our general counsel who's recording any of the questions that come up in order to, just for the record. So my second question is concerning also facility representatives is about, sir, can you please discuss how you've determined the appropriate facility representative field presence in this case, weighing the risk to the worker with the risk of ensuring that the contractors are performing their work safely? Thanks.
Yeah. Thank you, Mr. Summers. Very good question. And so it's not a question that's answered with one piece of data. You have to look at more than one piece of data. You have to look at what types of events are occurring. That's force reports. That's their own assessment findings. Are they reactive? Are they proactive findings? We have to look at are things happening that don't even reach the works level, right? So when I make a decision on what is the right level of oversight, I start balancing all those risks. I start engaging my facility representatives, asking them, how does our posture look right now? Are we understanding what's going out there in the field? Are we having a number of TSR violations? Are we having personnel contamination issues? And what's your level of confidence to facility representative? Talk to me so I understand. Talk to your AM, who's also a qualified facility representative, get an understanding of what is the best oversight. What does this model look like? Is there night shift happening too? And so as we went forward and started planning this, we looked at all the risk tables, and we came to the conclusion that one full-time facility representative each day is what is required. And if needed, they can call upon another facility representative, and they also have at their phone call away with any of our ESNH professionals who are more than willing to commit. So I think your point of your question is through a series of data points, we would come to a decision that in our work environment, that one day was acceptable for me to accept the risk of their exposure and also maintain a cognizance of the activities going in the field. We are fortunate here at Savannah River, my office with M&O, is that we talk every morning. And sometimes it's exhausting, sometimes things are boring. But we talk every morning to get an understanding of what is going on out there in the field. And so that's proven to be add value to it, is that transparency is being shared. And it's something that we really encourages our M&O to be transparent. We promise not to overreact. We also will want results. So.
Very good. Thank you very much, sir. Before I turn the floor back over to Ms. Connery, I do have one comment or one question that if you would be so kind as to define the acronym ALARA, which is very important for our public audience, which is also watching. Thank you.
You're on mute, sir.
Sorry, I said it so perfectly. I said, as a certified health physicist, I better get this right. So, as low as reasonably achievable, ALARA. Thank you.
Perfect. Thank you very much, sir. Ms. Connery, over to you, ma'am.
Thank you. I do want to, something you said earlier, triggered a thought in my mind when you were talking about, having to substitute people in, and I think Dr. Verdon mentioned it in both, as well as you, Mr. Armstrong, when you needed to have additional support, you were able to call on other facility representatives, for instance, to do that work, given the fact that there were a lot of people who were quarantined over the course of the pandemic. And thinking about kind of our conversation that we're going to have this afternoon with regards to the tritium facility and and concerns we had about like site-wide evacuations, I was wondering, was there any useful information or useful understanding that you got about accountability during the course of COVID? In other words, across site accountability for all of your workforce, that was probably something that was really essential during COVID, with so many people that were not necessarily out because they were sick, but because they had to quarantine because of who they were in contact with. And I was just wondering, is there a specific lesson learned that you gained from that, or was there an increased ability to account for the individual workers during the time frame?
Is that question to me, Ms. Connery?
Yes, sir.
Awesome. All right. I was hoping you'd give it to me. So during the pandemic, we learned really on supervisors the importance of communicating and engaging with our team. So what happened as a result of this pandemic is our supervisors, our assistant managers, were having more frequent team meetings to share information, share what's going on, keep people aware of what the office looks like, our future, all sorts of stuff. So in that period, it actually increased accountability. Now we're to a point where we're almost telling folks, turn your computer off, it's 4:30 or it's 5 o'clock. Go walk around a little bit. But now we see our folks who start earlier in the morning and they work later in the afternoon. And so then I start having other concerns, right? I want them to stand up, I want them to stretch. We're losing that other dynamic. And so actually accountability actually has increased during the pandemic. People are—
So I didn't mean accountability in terms of whether or not they were working. I meant accountability in terms of being able to literally know where your people are at any given time. Because in the case of emergency, no, that's fine. That's a legitimate answer as well. And I do believe that there's a lot of folks who are working overtime because of the fact that they're teleworking and working odd hours. But in addition to that, because accountability is important in the case of an emergency response situation, in other words, understanding where your personnel is at any given time, were you able to either increase the fidelity of that due to COVID, or have a better understanding of how that process worked within your own facilities?
I haven't delved deep into that during my time period here, and I can get back to you on that answer. However, what I'm aware of is that my AMs do know where all their employees are at all the time. They have their contact numbers, they have their phone numbers, and I know where all my AMs are at all the time. So it rolls up.
Okay, acronym-free zone, AM.
AM, I'm sorry. Yeah, so I'm the manager of the office. There's a deputy manager, a DM, and then there's our assistant managers. And I have assistant managers. One is for operations. AM is an assistant manager. Thank you.
Okay, I appreciate that. We are awash in acronyms. I want to make sure that anybody who's tuning into this can understand what it is we're saying. So I want to turn to my other board members to see if they have any additional questions, because I know we are running short on time. So, but please, if you have additional questions for our esteemed guests, Mr. Summers, Ms. Roberson, let me know.
I do have one question. I'll be brief, and I hope it's brief. Often innovation comes out of the necessity to respond to something. And you've talked a bit about how tightly you really managed the interactions, the oversight. And I know you guys are working on your return to plan work, just like the rest of us. I guess I'd ask you, Dr. Verdon, first, are there tools or practices that were developed because of COVID that you kind of said, this just makes sense, and you want to adopt longer term, you want to carry over?
Well, I think what we identified was basically different ways of accomplishing a mission because of maximizing telework, and so we are adapting to implement those. And and to judge, how well we're doing in that regard. So I do think, we did identify new ways to accomplish the missions, by using, virtual interactions as well as more frequent, one-on-one interactions with first line supervisors and things like that. So we're going to continue to carry that over. I think it was beneficial. But we also learned what didn't work, and obviously we'll work to change, to change those things around, and try to find out if we have to do it through teleworking, what, like IT, what improvements in IT might be necessary, information technology, desktop information technology that might be necessary to make it more efficient. So all those things are part of what we're learning from this.
Thank you, sir. Did you want to add anything, Mr. Armstrong?
I think what I would add is that as we entered the pandemic, we didn't realize how successful we can be with maximized telework. And been doing a lot of reading on this for the whole year, as probably many of you have. And I speculate that our future is going to even be more successful as we learn how to develop and execute a hybrid work environment. I think we're going to reach that perfect balance of life for people work from home and come into the office. I'm pretty excited about that future, and it's something that I'll be working with Dr. Burton and his entire team with moving forward. But I'm pretty excited about that future. I think we're going to get more innovation from folks on how to get things done.
Thank you, sir. Thank you both, and I don't have any additional questions, Ms. Connery.
Thank you, Ms. Robertson. Mr. Summers, did you have any other questions?
Ms. Connery, I don't have any questions. I do have a comment, and that is that I really appreciate the participation of Dr. Verdon and Mr. Armstrong. Really appreciate your answers and appreciate what you do for our nation. Thank you very much. Over to you, Ms. Connery.
Thank you, Mr. Summers. I want to echo the thanks for our panelists for coming in this morning and having this conversation. I do think it's an important conversation. I don't think that we want to exit our COVID posture without having cataloged both the lessons that we've learned, but also the opportunities that we have going forward to innovate and work smarter, not harder, right? As the saying goes. So I appreciate everybody's time this morning. We are going to break here and for lunch, so you all get to eat. And we'll come back at 1:15 to start the hearing for this afternoon's hearing, okay? So we'll meet back everybody at 1:15. And to our listening and viewing audience, we hope to see you back here at that point in time. Thank you all.